Hey guys, if you're new to my channel, my name is Boris. I'm a physician assistant. I work in outpatient internal medicine and also medically supervised weight loss. I've been practicing for about 6 months, and the topic of today's video is going to be the most gratifying part about practicing medicine. A lot of times you hear, it's so rewarding, working in medicine is so rewarding. Well, what does that mean? Why is it actually rewarding? Well, days like today, or at least a few examples from days like today, I think really illustrate why working in medicine, especially for me personally as a provider, is incredibly rewarding, and it was worth the entire 14-year journey to get here. And if you're new to the channel, you don't know about my journey, look back at some of my old videos. I talk a lot about it because medical programs are very competitive. PA school is very competitive, and I was not competitive at all. It took a long time, a lot of effort, a lot of grinding to finally get to the point where I got accepted and of course made it through, and of course I'm now, a practicing PA. But that's not what I want to talk about today. Today, I want to talk about why working in medicine is actually incredibly rewarding and gratifying. 2 examples I think will tell the story the best. First one, a patient I saw her about a month ago, and she, kind of heavyset lady. A lot of our patients are here for medical weight loss, but of course they also have a slew of other problems because obesity does cause lots and lots of comorbidities: sugar, cholesterol, blood pressure, pains in the knees and the joints and the ankles, all kinds of different stuff, not to mention anxiety, depression, things like that. But so this lady, pretty typical weight loss patient, lots of other comorbidities, particularly blood pressure. Usually younger folks with weight problems, that's the first thing that you see. Their blood pressure is really hard to control, particularly while they're moving up on the scale of weight. So as they continue to gain weight, blood pressure is just, spiking like crazy, and it's hard to control. And then once they lose even like 10 pounds, that's the first thing that you see. Holy crap, their blood pressure is so much better. What happened? Well, take a look at the BMI. They lost 10 pounds and now their blood pressure is leveled off, or maybe it's even gotten better. So that's something people don't actually think a lot about is, man, this person's blood pressure is so hard to control. They're on like 3 medications. It's still not controlled. Well, take a look at their weight. They continue to gain weight. And that's a very common response to gaining weight is your blood pressure just spikes. It just goes up and it's really hard to control. But the reason I'm telling you all this is this particular patient, blood pressure was kind of hard to control, so they increased their amlodipine, which is a very common blood pressure medication, calcium channel blocker, very effective blood pressure medication, both for systolic and diastolic blood pressure control. But unfortunately, one very common side effect is swelling in the legs and the feet, and not even like heaviness swelling, but painful swelling. Lots and lots of discomfort with this kind of swelling. And it's actually even worse in the summer. Fun fact, swelling in the legs and in the feet from amlodipine is worse in the summer. A lot of people don't know that. If you practice medicine, you should definitely know that. If you take amlodipine, you should also definitely know that. So this lady saw her for the first time, and so she's telling me about her weight loss, about her blood pressure. We're trying to get it under control. And so she tells me, as usually, oh, by the ways, hey, I forgot to tell you this, or wanted to talk about this for months, but I never brought it up. Those things always happen after you're done with them, after you're ready to go see the next patient, after, you spend 20 minutes and you realize you're out of time. That's when they tell you, oh, by the ways, that's when it always happens, right? And so that's when she goes, oh, hey, by the way, just one other thing, my feet really hurt. And I'm thinking like, crap. Oh, pain has a huge differential diagnosis. I really don't have 20 more minutes to ask her about this. And I'm just like, all right, well, real quick, how long has it been going on? What makes it better? What makes it worse? What medications are you on? Of course, I had the medication list. Just go into your very basic line of questioning. What's going on? Tell me more about this pain. And basically we figured out very likely it's the fact that it's her amlodipine. So she was on 10 milligrams, kind of a high dose. And so I was thinking, all right, I don't want to go through the whole, song and dance with x-raying her feet, going to podiatry, doing all that kind of stuff. I just want to try one thing and see you back in a month, see if this works. Let's reduce the amlodipine from 10 to 5, and let's just start a little bit of losartan or olmesartan, whichever ARB I ended up using. So we just basically, the whole treatment plan was just to reduce the amlodipine because I had a feeling that this was the kind of swelling and the kind of pain that she was experiencing. Could have been wrong, could have also x-rayed her, could have done my due diligence and done a lot more, but honestly, I was running out of time. I did have a pretty strong suspicion this was it, And so that's what we did. We added one blood pressure medication and we took away the one that I thought was offending, or at least we actually reduced it to a half dose. And so comes back a month later, guess what? She's lost a bunch of weight, she's walking, she's no longer wearing those compression stockings, she's actually got these like goofy Oreo socks on, which I thought were really funny. I commented on those. I was like, hey, I like your socks. I like it when people wear goofy socks. It makes things fun. And so she's like, her mood is all better, her affect is totally different. She's like, yeah, I've been walking, I've been getting outside, I can actually walk without pain. I'm not, wearing those stupid compression stockings. Like her whole life changed because we literally just reduced amlodipine 5 milligrams. That's it. That's all it took. And of course, I controlled the blood pressure by adding a different medication. I had to. Couldn't just let the blood pressure go sky high. But so that's literally all it took. Just a tiny little medication adjustment, and this person's life is completely turned around. She's losing weight, she's feeling better, she's getting active, she's getting outside, her affect, her mood is all better, everything is better simply because her feet don't hurt, simply because she is now on a little bit less amlodipine. That's it, like that. Her whole life changed with one tiny little adjustment, and because I took 30 seconds to listen to it. That is the definition of gratifying. That is the definition of rewarding. I could not imagine doing anything else for work than stuff like that. And to a provider, to someone working in medicine, it's so simple. It's such an unbelievably simple adjustment. Anybody should be able to think of it, and most, good providers would, but it just makes a world of difference to the one patient. So unbelievably gratifying. Things like that. That's one. Two, another quick patient story. One thing that me and the doctor that I work for really like to do is try to consolidate people's diabetes medications and try to get them on a GLP-1 agonist instead of all these other crazy blood pressure or crazy diabetes medications. Particularly glipizide. I can't freaking stand glipizide because the whole goal of controlling sugar is to prevent you from becoming insulin dependent. Well, what's glipizide going to do? It's going to make your pancreas poop out more quickly because it makes it produce more insulin, which, in the short term controls sugar, but in the long term, it makes you insulin dependent quicker because it makes your pancreas wear out faster. So these insulin secretagogues like glipizide are horrible. I can't stand them. Yeah, they're effective in the short term, but in the long term, they're terrible. So everybody I see on glipizide, I as quickly as possible try to get them off it and hope to God that insurance is going to cover a GLP-1 agonist, like an Ozempic, like a Trulicity, something like that. Trulicity's usually been our drug of choice, possibly moving over to Ozempic because some people have more sensitivity to the higher dose of Trulicity, but that's shop talk. That's a little complicated for this video. The point is, everybody I've seen that's not a very well-controlled diabetic or an uncontrolled diabetic, I try to get off the glipizide as fast as possible and onto Trulicity. And sometimes people can't tolerate it, they get nauseous, and then of course we have to reach into our bag of tricks and try to do something else. But the reason I'm telling this story, the positive, the optimistic side, when things actually work, is this guy. Not a well-controlled diabetic, A1C of 10.8, for months and years. So totally not controlled. And as we know, diabetes destroys blood vessels faster than anything else. Feet, kidneys, eyes, heart are the things that it attacks first. So you got to get sugar. Got to get your diabetes under control. For people who are treated, we like to keep the A1C around 7. People who are not treated, obviously, I want it to be as low as possible, under 5, under 6 preferably. So, but anyway, this guy, A1C of around 10, so I can only imagine how much damage is being done to the poor guy's body every single day that his sugar's that high, and he's on insulin, so it's just making his pancreas tire out even faster. Can't stand that shit. So, of course, what do? I try to get him on Trulicity. Don't change any medications yet because his sugar's still high. So I get him on Trulicity. What happens the next month? He's tolerating it. Unbelievably happy about that. I asked him to keep his glucose logs in the morning. He said, yeah, it went down. It's between 89 and, what did he give me? I think 160, 170 at the high. And of course, you only get those bottoms because he's still on glipizide. He's still on a little bit of basal insulin. So, okay, we can work with this. He's tolerating Trulicity. He's not throwing up. He's not having diarrhea. He's not having abdominal pain. Everything is good. And that's on the lowest dose. And his sugar is already way, 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 way better. An average of what I give you between 89 and 140 something or 160 something. Let's say the average is 150. That's an A1C of 7.8. Just very rough estimate. So that's already way better than what he's been just by adding Trulicity. And he's tolerating this stuff. And insurance is covering it. So, triple threat. We got it. He's using it, he's able to use it, he's able to get it paid for, and it's working for him. That's amazing. So that was probably the most gratifying part of my day. I was like, all right, you're tolerating it. Let's go up on the dose of Trulicity. Let's get you to 1.5. Let's get rid of that glipizide. You are officially off glipizide. Congratulations. That is my favorite thing to say in the world. And for those of you who work in primary care, take care of diabetes all the time, you understand exactly how much that warms my heart to get somebody off glipizide, to see their sugar is controlled, and to get them on a medication that you only have to take once a week, and that is much more effective. And also helps him lose weight, so that'll get rid of his diabetes and blood pressure and cholesterol issues, or at least control them much more in a simple once weekly, medication. And this is not a commercial for Trulicity or Ozempic or whatever. Not sponsored by these drugs. I just really like using them when they work. So yeah, basically, I guess the whole point of this video is to tell you why practicing medicine is so rewarding and so incredibly gratifying to a guy like me. It's that simple things, simple decisions, simple changes, just very basic things that, I know how to do can make all the difference in a person's life just like that. Sometimes, just like in a day, changing their medication, suddenly their feet and legs don't hurt, their whole life is different. Or over the course of weeks to months, changing their medications to ones that are going to be more effective, controlling their sugar, giving them a much, much better outlook on life and much fewer comorbidities down the line, and making it much less likely that they're going to have to be sticking themselves with insulin 2, 3, 6 times a day. You know what I mean? Like, just changing people's lives by doing something so simple, like clicking my mouse and ordering a medication. Couldn't do anything else. I couldn't do anything else. I love this job.